Welcome back to Total Thyroid. Today we will be talking about Scarless thyroidectomy and why it's really the absolute best option for most people who are thinking about having thyroid or parathyroid surgery. I'm John Russell, I'll be your host, and today we'll be talking about the top 10 reasons that you should consider Scarless, thyroid, or parathyroid surgery. So let's dive right in. Whenever people know that they need to have surgery, it's always a little bit scary. And you think about all sorts of different things. First of all, who your surgeon is going to be, how much of your thyroid you need to take out. That's a huge question that really goes into how big your cancer is, whether or not you have Graves' disease, autoimmune disease. So many other things come into play about that. We're not really going to touch about those for right now. Those are worthy of podcast in and of themselves. But for today, what we will talk about quite a bit is the top 10 reasons that you should know about as you're deciding whether or not you should have Scarless thyroid surgery. If you need to have surgery, there's a good chance that your surgeon hasn't even mentioned this to you because it's not super common. I am kind of the guy who does more of this than anybody else in the United States or even the Western Hemisphere. And so I want you to kind of know what the advantages of this are and why I think it's the best option for most people who need to have thyroid surgery. Without further ado, here are 10 reasons that you should think about Scarless thyroid or parathyroid surgery and why it might be the best option. First of all, there's no scar. And it kind of goes without saying that this could be an advantage for some people. A lot of people in North America feel like this is something that they should almost be embarrassed about when they consider worrying about a scar. Clearly, your overall health is the most important thing, and a scar is probably not your highest priority. But we know that the scar does affect people. And in fact, only about half of patients 5 years after thyroid surgery think that their scar looks excellent. And the rest of the patients kind of feel like there's room for improvement. 20% of patients feel like their scar makes them self-conscious, at least a little bit. And about 10% of patients feel like they need to have some sort of plastic surgery or procedure to make their scar look better. And that's from a study out of the University of Indiana done a few years ago. And so we know that it's not just about vanity. We know that there's something that makes people actually feel bothered by their scar, and it's pretty consistent. There was another study done from some surgeons in Chicago that actually found that the number one complaint, the number one thing that people complain about after thyroid surgery is actually their scar. They're worried about how it looks. They're worried about wound breakdown. They're worried about minor or temporary complications that can come with having a scar. At a minimum, you have to keep it out of the sun. So the first advantage of having Scarless thyroid surgery is that you don't have a scar. And because of that, you can go sunbathing the next day. You don't have to keep it covered when you're outside. You don't have to worry about scar complications. And long term, you just don't have to explain it to people. It's not about vanity. It's just about keeping your health information private. If you want to tell people that you had thyroid cancer or Graves' disease, be my guest. Go ahead and tell them. But if the random guy behind you in the checkout counter doesn't need to know that you had thyroid surgery, you don't have to tell them if you have Scarless thyroid surgery. So that's number one, but I promised you 9 more, so let's keep going. Next, there are some reports that say that when you have Scarless thyroid surgery, at least through the transoral approach, you actually have less pain, which means that your recovery could be easier. This is a complicated topic because it depends a little bit on the surgeon and how they do your approach. What I have heard from my patients in the past is that they are grateful not to have incisions on their neck because they're worried that those would have been more painful. Most of our patients take 1 or no pain pills the night of surgery, and it seems to be a pretty straightforward recovery. The study that I'm referring to came out of Thailand, where they've done lots and lots of Scarless transoral surgery, and they did find that their patients took less pain pills and complained of pain less frequently when they did not have a visible scar. That's actually a good point. There's different societies in which having a scar matters more or less. There have been studies that suggest that people of Asian descent are more bothered by a scar. There are people with certain cultural or genetic backgrounds that might be more bothered by a scar. There are people who are multiracial who might actually have worse scar healing and might complain more about their scar afterwards. So there's a lot of different factors that go into whether or not you care about a scar. And really, all that matters for you is whether or not you care about it. And if you care about it, that's good enough for us, and it should be good enough for anyone. So again, number 1 was the fact that you won't have a scar. Number 2 is the fact that you might have less pain while you're recovering. Number 3, there are some reports that suggest that voice outcomes are better when patients have surgery without a visible scar. These reports primarily come from South Korea. I will tell you, in my own experience, it is extremely unusual to have a patient with a permanent voice change. With Scarless surgery, I have exactly 0 patients in my entire career who have had permanent voice changes. And so that is something pretty relevant for you if you use your voice every single day. There's lots of potential reasons for that, but there are some very well documented studies using high level laryngology tools and speech pathology to really document that voice outcomes seem to be better, especially in the short term, as you're recovering from surgery with Scarless surgery as compared to open surgery. So, something to consider if you need to have thyroid surgery and you're trying to decide what type of surgery to have. Next, we in my own personal opinion, and we have some research about this when we use the robot, but limited when we're using laparoscopic surgery, we get an excellent view because of how magnified everything is when we do scarless thyroid surgery. The cameras that we use magnify everything 10 times, 50 times, so that it's significantly larger and we can see everything very, very clearly, depending on the size of the screen that we use. It depends on the amplification, but we can see these things extremely well. It helps us, again, to protect your voice nerve, to protect parathyroid glands, and to make sure that you have the best possible outcome. One of the things that I love about this is that because these cameras allow us to do things that our naked eye can't do, it allows us to continue to iterate and to get better and better over time, which is one of the things I'll come back to in just a few minutes. Next, when we're doing, and this goes back to the cosmetic benefits of scarless thyroid surgery, when we're doing scarless thyroid surgery, it allows us to combine a neck lift or a segmentoplasty kind of at the same time. The way that we do that is we can either do liposuction, where we just remove some of the fat underneath your chin, or we can even do a full segmentoplasty where we actually excise extra skin and the fat underneath your chin. So if you're worried about having a turkey neck or a double chin or something like that, it's usually pretty straightforward for us to simultaneously address that at the same time. Again, that's a cosmetic advantage, but it's a real advantage for some patients who think that they might need to have thyroid surgery and they're on the fence about it. It's something that we can just kind of add in there to make them feel a little bit better about losing an organ that we all know is so important. Next, when we think about innovation, and this goes back to the comment and conversation that we had about cameras, we know that our naked eye is kind of a limitation for us as surgeons. We are really good. Those of us who do lots and lots of thyroid surgery are really good at identifying these critical structures, but we will always have a limitation that our eye can only see so much. When you start to add cameras, I think you've all had some experience with this when you're driving your car. Modern vehicles have extra advantages that they help you to see your blind spots. And as you start to merge over, you'll get either a flashing light, or some cars will even kick you back out of the lane if there's another car that's coming up in your blind spot. In the same way, as we innovate with these cameras doing scarless thyroid surgery, we have the opportunity to continue to improve and get better and better results that we can't necessarily do as well or as easily when we're just using our naked eye. And so the potential for future innovation to make thyroid surgery safer and safer is 100% part of what drives us as researchers to want to use and innovate with these products like scarless thyroid surgery. Continuing on, and I think that's 1 was no scar, 2 was less pain, 3 was a better voice, 4 was the fact that we might get better views with cameras, 5 was that you could have a neck lift at the same time, 6, we can innovate and combine to make your surgery even safer. Number 7, most people don't know this, but scarless surgery is something that's actually quite excellent even for cancers. We have a growing amount of data looking at long-term results. In fact, I'm part of a study right now that we're looking at our results with cancer outcomes for patients who need to have scarlet or choose to have scarless thyroid surgery. And what we've been able to find is that those outcomes are uniformly excellent and not any worse than the traditional approach. That leads right into number 8, that we can do this very well for patients who have lymph node disease, especially in the middle of their neck. That Scarless transoral thyroid surgery gives us an excellent view down even all the way into the top part of your chest to be able to take out the lymph nodes that are the highest risk. That's a little bit different than some of the other scarless surgical techniques when you're doing the breast approach, when you're doing the retroauricular approach, or even the axillary approach. All of those approaches have different views of the lymph nodes, but the Scarless transoral approach gives us such an excellent view that I would say is probably even better than the open approach at letting us really look down parallel to that nerve and be able to see and remove all of the lymph nodes. Numerous studies have demonstrated that the lymph node yield between scarless surgeries and open surgeries is very similar, if not better in some studies. So we really like the fact that we're able to clean out those lymph nodes very well and clearly. Next, it's also an option. Scarless transoral thyroid surgery is a great option for patients who have Graves' disease or Hashimoto's thyroiditis as well. Patients don't always know this, and a lot of surgeons don't either, but we actually get such excellent outcomes with these surgeries that depending on the size of your thyroid, you may be a candidate for scarless thyroid surgery. In fact, you usually are when you have these other conditions as well. And so I love the versatility of the technique, that it allows us to help these people with these chronic autoimmune conditions to move past them. Once you have had your thyroid removed, most of the time, the antibodies from Hashimoto's thyroiditis and from Graves' disease will slowly go away. And within a few years, most patients do not have those antibodies anymore. In fact, we can use those antibodies if you have cancer to determine whether or not your cancer has also gone away in some cases. So I love the fact that we can use scarless thyroid surgery for autoimmune thyroid problems as well as cancerous or even benign nodules. Finally, the biggest thing to me, and this is something that we don't really talk about all the time because it's hard for us to research, but what I hear from my patients who have had scarless thyroid surgery is it allows them to move on. If you have young children, it allows your young children not to ask you, "Mom, hey, what happened to your neck?" If you're a grandparent, you don't have to explain it to your grandkids. Again, you don't have to be talking about it to the person in the checkout line behind you or to any of your colleagues when it's none of their business. I love the fact that our patients who have had thyroid cancer with a really good prognosis or autoimmune diseases with a really good prognosis, they are able to move on. They don't have to be reminded about their surgery or the thing that they had to go through every single day when they're brushing their teeth or putting lotion on their face or doing whatever they do every single day. You don't have that constantly visible reminder of your scar and what you had to go through. And there's some early research that suggests that that might be associated with a better long-term quality of life. In fact, we did some research while I was at Johns Hopkins that found that with regards to your health-related quality of life, people have about 3 times better cosmesis, even 3 years after surgery, when they have scarless thyroid surgery. So those are my top 10 reasons that I think scarless thyroid surgery is probably the best surgical approach for most patients in North America or the world who to have, if you need to have thyroid surgery, that seems to be the best approach. Now, here's what you do definitely need to know. What you need to know is that scarless thyroid surgery is very operator dependent. And so the more that your surgeon does, the better outcomes you're going to have. In fact, that's the reason that the Clayman Cancer Center tried to hire me a few years ago. Made me just a great offer, but it was not the right fit for me. And instead they ended up hiring somebody that I had trained. And so as you look at these different things, as you look at these options, there are people that recognize the value of this if you can find the right surgeon. We are very fortunate to have many, many patients come to see us for scarless thyroid surgery. And we just love to see these patients 6 months, a year out from surgery and just see how well they've moved on from their problem and how they've just totally put it in the rearview mirror and moved forward. So if you are considering scarless or even need to have thyroid surgery at all, you owe it to yourself to investigate this procedure more. Ask your surgeon about it. Ask your doctor about it. They might not know a lot of information. And one thing that we find is that a lot of times these other doctors who don't do it very often might tell you that you're not a candidate. And if you've heard from your surgeon that you're not a candidate, please reach out to us if you're interested. We're happy to talk to you and let you know. Most patients, we've researched this across the world with other institutions. Most patients are eligible to have thyroid surgery without a scar. And most patients seem to do a little bit better if they choose to have thyroid surgery without a scar. So those are the things that I love about scarless thyroid surgery, the top 10 reasons that I think that most patients are best served if they have scarless thyroid surgery. Drop a comment. Let me know kind of what you think and what your thoughts are about this technique and how to move forward with it. Please reach out to us. Our email address is russell-center.com or find us on the web. Thanks for following. Thanks for listening. Please share this with anybody else and let me know what you think.